This is Walker Street Doctors weekly update for the week beginning Monday, the 24th of May. We recognise that as a patient it's difficult to keep up with the changes and hence this weekly update. With regards to COVID vaccinations, each and every one of our staff members are now vaccinated. Our patients are taking up our offer of COVID vaccinations in increasingly large numbers now, and we now have increasing supply to be able to meet that demand. We're obviously extremely fortunate as Australians to have access to COVID vaccinations, and Walker Street Doctors remains committed to providing this community service to vaccinate our individual patients and our population. There are logistical challenges in doing this though. We need to do this through a dedicated clinic because there are exactly 10 doses in a multi-dose vial with strict storage requirements, and it would be unethical to waste precious doses. We're now vaccinating 80 patients per week, all day on Thursdays and on Friday afternoons. And we've also opened an extra Saturday morning clinic on Saturday the 5th of June to cope with the extra demand for vaccination. We're looking to run a second Saturday morning clinic on the 3rd of July if the first one is successful. Each of those patients must wait 15 minutes following vaccination for observation. Yet we're still obliged to meet our COVID safe plan in terms of social distancing. So moving forward, we've made the decision to continue with face-to-face appointments for all other general practice appointments only from Monday to Wednesday and Friday mornings. And telehealth appointments only will be carried out during the COVID vaccination clinics for all doctors not involved in the clinic. We enjoy providing telehealth consultations to patients in their office or in their home or even in their car, stationary car that is, and the feedback from the overwhelming majority of our patients is that they do too. We get to take our masks off, and you get to avoid traffic jams, parking hassles, and mingling with sick people in doctors' waiting rooms. All of our doctors are now very skilled in performing telehealth consultations, and they will absolutely invite you in for a face-to-face consultation or for examination or to make other arrangements if required for complete and comprehensive care as we always have with the old model of general practice. We can still organise your Medicare rebate for a video consultation as we always have for regular consultations. Just a reminder though to email us a high resolution photograph of the area well ahead of your appointment time if you think that might be useful. There are still a few patients who are notable exceptions who just can't get out of the habit of coming into a practice, and a few who prefer telephone to telehealth video appointments. It's worth noting that the telephone Medicare rebates for everything except very brief consultations will finish in June, and so it may be worthwhile switching over in order to avoid significant out-of-pocket costs for the consultation. However, video telehealth rebates will continue. HotDoc, our booking and video consultation platform, make it easy for both of us. Either click the link in the confirmation email sent to you at the time of your consultation, or respond to the SMS that sent to you as your doctor starts the consultation. I will also take the opportunity to remind patients that if a repeat specialist referral or repeat script for regular medication is required, please do jump on our website where you'll find the repeat script or referral, green button, and then follow the steps. This obviously is not an appropriate forum to request a mental health care plan or to request x-rays for acute injuries or similar matters like that. I know that as a patient it's really hard to keep up with the constant change. The rules are changing almost every week, and hence the need for this update. So in summary, we're still wearing masks at Walker Street Doctors and still sanitising and still social distancing. Thursdays all day and Friday afternoons are telehealth only, except for COVID vaccination. Face-to-face appointments will take place on Mondays, Tuesdays, and Wednesdays all day, and on Friday mornings. If you're booked in for a COVID vaccination, please call us to defer your appointment if you're not well. I hope this update has been helpful.